There's been a lot of conversation in Canada the past few days about the new modeling projections released by Dr. Theresa Tam and Public Health Agency of Canada when it comes to where coronavirus cases are heading in the country, particularly with new variants added into the mix. And a lot of people, regular folks, persons in the media, medical experts, were scratching their heads at these new graphs they released in their latest slide deck because it shows something that's quite a doozy. It shows cases almost immediately skyrocketing high up like a rocket ship to very large heights of over 20,000 cases a day by the second week of March. So right now we're hovering around 2,000, 2,500 cases a day in Canada, but in just over 2 weeks' time, apparently it's going to multiply tenfold over. How is that possible? Well, Dr. Tam says the main way to avert that sort of catastrophe, you need to bring in enhanced measures, I guess meaning locking down further than we already are. Wow, that's something. And a lot of these experts asking, well, what were the assumptions underlying this modeling? What were the inputs that were put into it? And Conservative MPs actually at a health committee meeting on Friday asked those very questions to Public Health Agency of Canada scientists, and they couldn't really answer the questions. They just, passed the buck and said, well, we'll table answers with you next week. We'll send in some written submissions to you a week from now. I think one thing that's kind of valuable, though, is going back and looking at some of the previous reports that Theresa Tam has released. One in the middle of November, middle of December, and middle of January. Because what's interesting about those reports, and they have nothing to do with the new variant, is they kind of show a similar thing. Basically, they all show this one scenario where if you relax measures, bam, cases are just going to go crazy through the roof. If you keep doing what you're doing now, there's going to be a steady uptick, a gradual increase of them. But if you further reduce your contacts, meaning people just don't see each other anymore, you leave the house even less than you are and bring in more measures, more lockdowns, that's the only way cases will decline. That's kind of interesting because when she brought that out in November and then says in a few weeks cases are going to start to build, that graph actually kind of looks like it's accurate because as we know, there was a building line that happened throughout December. It continued to grow, but then it peaked around January 8th. And if you go back to her December report, her January report, she does not predict that those drops are going to happen. So it's very instructive to look at this new modeling with the new variant involved and realize the similarities between the previous modeling. Basically always saying, look, if you see more people, cases are going to skyrocket. If you bring in more measures, they're going to decrease. It doesn't seem like they're factoring many other variables in, like explaining what's going on all across Canada right now in different provinces and in different parts of the United States, where we have seen since the first week of January a dramatic decline in the cases that are currently happening. Now, I know a lot of officials would like to say, well, the reason that those cases have been declining is because we brought in lockdowns. For instance, Ontario started a lockdown around about Christmas time, and they say that is why you're seeing that rapid decline. But that rapid decline has also been occurring in US jurisdictions that do not have lockdowns in place, and it's almost an exactly identical one in terms of the way the curve goes, when it started, and so forth. So kind of instructive to see, well, Dr. Theresa Tam putting out some scary figures just last week, but it's not the first time. She's been doing it for several months, and well, the results are quite a mixed bag.